This is correction of botched CoolSculpting with Vaser liposuction of the abdomen. Now this patient had CoolSculpting of his belly about 5 years ago, had 2 sessions, and then noticed something that's not exactly common, but it's not as rare as you might think, and it's called PAH, or Paradoxical Adipose Hyperplasia. It means that the opposite of the CoolSculpting treatment happened. Instead of the fat going down, the body actually responds by making it thicker, and it makes the belly bigger. And you can see here, he had it treated in this area, and it actually made it fuller. And so this happens not commonly, but it's, I think, a little underreported in the literature. Anywhere between about less than 1% to even up to 2% of the cases. So it's definitely out there. I've seen it, I've treated it before. The treatment options for this obviously is not more CoolSculpting, it's to go and reduce the fat. So how I'm gonna approach this is to use Vaser liposuction through tiny little incisions to really try and melt this fat and suction it out. Operating on a CoolSculpting abdomen is almost like operating on someone who's had surgery before. There's a lot of scar tissue, a lot of fibrosis, and that's why the Vaser is a great tool to be able to break that down and get as much correction as possible to undo all the negative effects of that CoolSculpting. So here we are in the operating room, and he's laying down. I've marked out the area where the problem is. You know, CoolSculpting is a way that they freeze the fat. They put these external probes on. It's really cool the temperature of the skin, and what that does is that temperature reduction goes down to the fat cells and they rupture and eventually get absorbed and excreted over a period of a month or two. That some patients get actually an increase in fat cells. A very famous and popular example of this was Linda Evangelista, the supermodel from the 90s, who had CoolSculpting of her abdomen and got really severe PAH. My plan here is I'm gonna make 2 little tiny incisions here, put some fluid in here, and then Vaser this all down, because this is gonna be very scarred, and then I'm gonna suction that out. The Vaser is a great tool for this, to really get this down. Just using traditional liposuction doesn't work very well. And again, I follow my principles of the pinch test, and you can see when I pinch up here or here, how thin that is. When I pinch here, it's really thick. And not just that, it's very fibrous-y. So I'm gonna get started with some fluid, and I'll bring you back in. So just to show you about what I meant about that scar tissue that kind of forms, I'm just trying to put fluid in here, and you can see my tumescent probe, how it hits all this scar tissue. In a traditional belly, this would just go in like a hot knife through butter, but this is really hitting that, and that's why these cases become very challenging, and why the Vaser has to be used in these kinds of cases. So I've also come across this in gynecomastia surgery. I've had some patients who've tried to treat their gynecomastia with CoolSculpting, and not only would that not work because it doesn't treat the breast tissue, but in those cases they also got this just explosion of extra fat that made their gyno look even worse than what it was before the CoolSculpting. So I've operated on this, and it's interesting, like in those cases, when you go in and try and cut that fat looks very different than normal fat. There are these little, really thick, big globules of fat, and when you try and grab them, they just kind of disintegrate and they shatter. So it's a really difficult surgery. So that's why, in this case, obviously, I'm not going to make a big incision to cut this out. I'm going to do it with liposuction. But in those gyno cases, I've seen what that fat looks like. And of course, that fat probably looks the same in here. So I'm going to do as much as I can to get this as flat as possible. So I just finished this Vaser liposuction of the belly for CoolSculpting PAH, or Paradoxical Adipose Hyperplasia. I got about 750 cc's of fat, and you can see now the contour is so much better, especially compared to the before. So visually it's better, but of course I always look at the pinch test too. So now when I pinch here, up here versus here, very similar now. This type of fat does not go away with diet and exercise either. It's a very resistant fibrotic type of fat, but the Vaser help. And I think he's gonna do really well overall with his contour, and this is now his new baseline. So I'm gonna put the dressings on, get him to the recovery room, and we'll be done. Till next time, guys.